Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, huge article out of Michigan Public, NPR National Public Radio, based out of Ann Arbor and the University of Michigan. Ascension staff petition for safety precautions amid ransomware attack. More than 100 people have signed a petition circulating among medical staff at Ascension Providence Rochester Hospital during the ongoing fallout from the ransomware cyber attack that hit Ascension May 8, 2024. The date on this report is May 27th. Michigan Public writes, doctors and nurses throughout the state have been raising serious concerns about the impact to patient care. They still don't have access to patients' medical records. Safety protocols intended to reduce the risk of medication errors have been temporarily removed or disabled. Crucial lab and test results are taking hours or getting lost completely. And elective surgeries and patient transfers are still happening despite some staff's concerns. There's some real revelations in this petition language. It reads, we the members of Local 40 at Ascension Providence Rochester Hospital are deeply concerned about the current challenges faced by our healthcare professionals due to the cyber hack incident and subsequent lack of access to patients' electronic medical records. We demand that immediate safety precautions be implemented to ensure the well-being of both our members and the patients under our care. They want to implement daily unit shift huddles to ensure effective communication, coordination, and information sharing among healthcare professionals regarding patient care safety protocols and any emerging issues. It looks like Ascension is keeping staff in the dark on things. My own dealings as a patient with Ascension, highly compartmentalized. This goes for the mini-me outfits as well. You can see in some of the reviews of these places, the different levels of staff and management are not privy to what the other levels are doing. They don't share information. It's a need-to-know basis. This is a sign of high corruption. I ran into this in my own case. You go to their emergency department, you're self-pay, no insurance, and they may tell you that you have a neck muscle pulled when in reality you broke your skull and had a life-threatening injury, such as myself. Then after you spend a couple tens of thousands of dollars or something, they'll come back and give you a proper diagnosis. Each injury that you take into a hospital or doctor, they've got a price tag in their mind for how much it's going to take for them to tell you the truth about your injury and give you proper service. The petitioners are also asking for regular training sessions for staff members to enhance their knowledge and skills in navigating the challenges posed by the ongoing cyber hack. What this tells me is that Ascension, and all their wisdom and $18 billion of cash reserves, did not have a contingency plan in place, set up, and ready to implement to deal with this current crisis. You can see in my video I put up yesterday, the big shot doctors, millionaire doctors, and administrators, they're heaping the responsibility and risk on the lower level staff, including staff that don't have proper medical credentials. They're asking nurses who don't have training in a certain area to go and do jobs they don't know how to do. This stuff should be against the law. Back to the petition. They want Ascension to provide weekly progress reports to update staff members on the status of efforts to resolve the cyber hack incident, restore access to electronic medical records, and address any safety concerns or staffing issues. The petitioners are asking Ascension to maintain a maximum 4-to-1 nurse-to-patient ratio until the matter is fully resolved to ensure that patients receive the level of care and attention they require. Alright, so here the staff are drawing attention to the fact that because of all the chaos from the cyber attack, disrupting the just-in-time management system in place. They now don't have adequate nursing staff to tend to the patients. And in the best of times, prior to this cyber attack, you can see where Ascension already had staffing shortages. It's down to choice in order to streamline their business and profits.